The House would give DHS enough money to continue services through February 28th to allow for negotiations on border security funding. And we're live from the Health Action Conference in Washington, where shortly we'll hear remarks from former candidate for Georgia Governor Stacey Abrams. This is live coverage.
Our next speaker is an amazing woman who has shown our nation care for her people, care for all of the issues that we are aware of, and care for the heart of our democracy. Stacey Abrams was the first woman and African American to lead the Democratic lawmakers in the state of Georgia. For 7 years, she led the House Democrats in the Georgia legislature, both challenging and working with a Republican governor and majority in Atlanta. I've been to Georgia, and I know that what could not have been easy. Last year, she broke through barriers again by becoming her party's nominee for governor and winning more votes than any other Democratic candidate in the state's history. Well, she lost the race by less than 2% of 3.9 million votes. These facts highlight an amazing woman who can galvanize people. But we should also know she was born in Gulfport, Mississippi, that her parents were active in the civil rights movement, so we know how she got her sense of justice. She moved with her family to Atlanta when she was young, and her mother and father studied at Emory's University Theological School and became United Methodist ministers. Have to say, as a Catholic sister, I feel really comfortable with a fellow sister in faith. She's a graduate of Spelman College. She's in the University of Texas and Yale Law School, and she has all these amazing degrees and awards. She was a recipient of John F. Kennedy New Frontier Award in 2012 and as a Governing Magazine Public Official of the Year in 2014. And she's a lifetime member of the Council on Foreign Relations. And she's a DC favorite, a current member on the board of directors for the Center of American Progress. She's founded multiple organizations. She inspires people to get to work, and she shepherds that work. She's now the founder and chair of Fair Fight, an effort to advocate for election reform and ensure that all voters have access to the polls. And as we know, her home state had a little trouble with that this year. She's also launching an organization to get a fair count in the census. And those of us that care about healthcare know how important this decennial census count is. So I'm really grateful that she's engaged in that fight. Well, and one more thing that I want to say is when we were in Savannah on the bus, we met a mom and 2 young kids, and the mom said to me, I've never been political, but that's Stacey Abrams. She just made me get up and get involved. And here the mom was going with her 2 kids door knocking. So I am so honored and pleased to welcome to the stage Stacey Abrams, a woman who gets us off the couch.
Thank you. Sit down. Sit down. Thank you very much. I'm going to do something that I think never happens. I'm going to correct Sister Simone Campbell. God be with me. Thank you for such a generous introduction, for such kind words. But we didn't lose. We just didn't get the governor's mansion. And I say that to say that we turned out 1.9 million people who stood up and demanded Medicaid expansion in the state of Georgia. We turned out 1.9 million people who said that maternal mortality rates in our state were too high and the efforts being made were too little, and we would not stand for it. We turned out 1 0.9 million people who said that the escalating epidemic of AIDS in the state of Georgia is an abomination, and they would not stand silent any longer. And so yes, by the final count, I did not have the numbers, but I had the moral victory, and we're going to get a real victory on health care issues in the state of Georgia. That's why I'm here. Because as everyone in this room understands, our victories sometimes feel like losses. It's a game of inches and not miles. But every time we make progress, we save real lives. And that's one of the reasons I'm so grateful that I have a chance to be here this year with Families USA. I've been invited before, but for 7 years I've been held hostage by the Georgia General Assembly. And despite my request, they would not let me leave to come. This year I'm unemployed, so I'm here. But I want to talk to you a bit about why I'm here and why this matters so much to me. As Sister Campbell said, I grew up in Mississippi. I was technically born in Wisconsin. I remember being cold and eating cheese curds. My parents raised us in Mississippi, in Gulfport. But my parents, despite working full-time jobs, did not have health insurance. And so when we got sick, we had to be really sick, because to get access to a doctor could mean a week's paycheck. It could mean making a difference between whether the rent was paid or you could get the medicine you needed. So my parents were very careful about when they sought medical care for their children. Now, they never, ever put us in harm's way. But I know they went without many times to make sure we didn't have to. Fast forward to 2013, I was a member of the Georgia General Assembly, but I was also someone who had started a nonprofit organization during my law school years at Yale, and I started an organization to help disadvantaged communities. It was called Third Sector Development. I'd used this organization many times over the years, once to help my parents when they were doing Hurricane Katrina relief work in Mississippi. Because after finishing grad school in Georgia, they moved back to Mississippi to both serve in the ministry. And that organization helped find food and relief for victims of the hurricane. I worked with nonprofit organizations across the South and Southeast that were doing good work to help others. But in 2013, I was part of a coalition with Georgians for a Healthy Future, because we recognize, you can cheer, I like you guys. Yeah. You see, we had a governor who did not support the expansion of access to health care. And so in one of the meanest acts I'd seen in the General Assembly, and I'd seen many, he refused the resources offered to navigators in the state of Georgia. The University of Georgia had a group of navigators that were getting direct federal funding, so they were able to act. Nonprofits were able to secure funding. But there's a swath of Georgia known as Southwest Georgia that did not have access, but they were also the most, they had the lowest insurance rate, they had the highest prevalence of need, and they were the most uneducated about health care. And so looking at that population, I became very concerned, because I knew that they were the very ones that the Affordable Care Act was designed to support. Now, as Democratic leader in the House of Representatives, I had the imprimatur to tell my members that if they would engage in signing people up for the ACA in their districts, I could help support them. And we were able to dispatch so many meetings that we had more than 130 ACA signups throughout the state of Georgia in 2013, more than any other state had through their state legislature. I personally got in my car and went to the Republican districts where they wouldn't talk about the ACA. And that is a story for another day, and when I start to drink, I will do it. I'll tell you about it. But I went to parts of North Georgia where they did not allow Democrats. I went to parts of the state where race issues remain strong and divisive and corrosive. And yet, when I stepped into those spaces to talk about health care, folks showed up. I remember going to a part of North Georgia, sitting in a church that was on a mountain. I drove in early because they told me I needed to make sure I made my way back down the mountain by the afternoon. And I sat in that church telling a group of people who would never think to vote for me for office about how they could sign up for the Affordable Care Act because their representatives, their leaders wouldn't tell them. And as I sat in that room in that church and I helped sign folks up and we got things done, this gentleman who was the polar opposite of me, an older gentleman, he was too young for Medicare, but he was already ill. He didn't have the health insurance his job had promised him, and he didn't know what he was going to do. And he sat in front of me and I walked him through the process, and when I finished, he said to me, "Now, I ain't never voting for you, but thanks to you coming here, I'm never going to vote against you." I have no idea what that means. But that was his way of saying thank you. I'm fairly certain he voted against me. But what he wanted me to understand was that in his mind and in the minds of his neighbors who sat in that room listening to me, a woman from Atlanta, tell him about health care, he understood that health care isn't partisan. He understood that his ability to live or die should not be a question of which side he voted on, that he had a moral right to health care. And that was my responsibility. And I think he understood that he had a woman who was telling him how to get it done. And so through the General Assembly, we were able to do the work across much of Georgia. Through my independent efforts, I was able to go to parts of Georgia, but we still had this concentration in Southwest Georgia, the highest concentration of the uninsured and those facing comorbidities that would shorten their lifespans. And that's when I had conversations with Georgians for a Healthy Future. And we decided to go into partnership. My responsibility was to do the work of signing people up for the ACA. And so I reached out to a few foundations, raised about $150,000, and then went into those communities and hired community members, many of whom were unemployed, paid them $15 an hour, and got the SEIU to come down and train them for 3 days in a hotel just outside of Macon. And we trained these family members, we trained these community members to talk about health insurance, to talk about it in communities that didn't understand what it was, had no idea what they were being offered. And by virtue of these women and men, these community members who didn't have health insurance themselves, we boosted the sign-up rate in Southwest Georgia over 39 counties by 25% or more. And so when I say we win, I mean that we win victories despite those who are supposed to be in leadership fighting against us. My mission, of course, has been to be someone who holds a position of political power so we can cut through the detritus and the disrespect and the myths. But until that happens, I need all of us to understand that we can still win even if we don't win the offices we seek. Even if the people who win those offices tell us they don't believe what we believe. Because I believe in a greater power, a force that is stronger and more prevalent and more pervasive and more pernicious because it believes that it can eradicate hate and evil and poverty and make good shine throughout the United States of America. And that is the work that we are here to do. But here's how we do it. Number one, we have to educate. Say educate. Educate. With groups like Sister Strong talking about reproductive justice. Groups like Hemophilia Georgia who help us understand the necessity of talking about those diseases that we know about but we don't quite think about. With groups who face sickle cell anemia and cancer. Those groups that are fighting for maternal mortality rates to go down and infant mortality rates to be eradicated. Those are the groups that have to educate. Because we can't assume that people know what we know. This is a complicated world we live in. And particularly for political leaders, we're often bombarded by lots of different information. But there is nothing more fundamental, nothing more sacred than the human body. And so your ability to cut through and talk about your issues has to be first. We have to educate leaders about what's out there. Don't assume that they know. It's amazing the transformation that happens when a leader's family member suddenly faces a healthcare crisis. It's like being on the road to Damascus every day. We have to create that road for leaders, regardless of their party, because they're people first. And so take your time and educate folks. Don't assume they know because you know. This is your life. Make it their learning. So your first job is what? Educate. The second job is advocate. Say advocate. Advocate. Families USA does this work. Georgia Watch does this work. Georgians for a Healthy Future do this work. But the work that has to be done is that we cannot simply say what must be done. We have to explain who should do it. And advocacy is not just about going to those who are in elected office. You got to go to their bosses, the people. Because most citizens understand that they vote and their votes matter, but they don't know how the dots are connected. One of the transformative parts of our campaign was that I talked about Medicaid expansion everywhere I went to, everyone I talked to. I talked about Medicaid expansion to the Georgia Chamber of Commerce. I did, many times. And this matters because they have not been the strongest advocates for full Medicaid expansion. But the reality is when we cede our ground, when we decide that there are spaces we cannot advocate in, then we give the other side the space to come in and control the conversation. There is no space that is not ready for a conversation about health care, because our economy depends on the very lives we are trying to save. Because the vibrancy of our communities relies on us having a strong healthcare economy. Because people don't move to places where they can't take care of themselves and their families, and so we have to talk about healthcare. We have to advocate for healthcare change. For me, that mission is Medicaid expansion because it saves rural hospitals. It saves mamas giving birth in counties without an OBGYN, which is in half of the counties in Georgia, 79 counties do not have an OBGYN. 64 of our counties do not have a pediatrician. And so for me, this is a moral crisis, and I will advocate for it whether I'm running for office or just running my mouth. But advocacy has to be real and constant, and there have to be consequences. And there is no stronger consequence for a political leader than losing that job. So the first job is to what? And the second one is to? Advocate. And the third one, I usually say agitate, but I'm in a nonpartisan setting. And so I will say activate. Say activate. Activate. Once you have educated, once people understand what's at stake, once they understand why the AIDS rate is going up in the state of Georgia, once they understand that rural hospitals are shutting down in Ohio and Indiana unless you expand Medicaid and finally it happens, when you advocate and Montana finally decides to expand Medicaid, even though they're having some trouble with their implementation plan, when states start to join the bandwagon, when we've done the work of education and the work of advocacy, activation is necessary. Because I don't know if you know this, but sometimes politicians say things and they don't follow through. I know, it's shocking. But activation is about going beyond advocacy. It's about showing up after the budget has passed, showing up after the report has been issued, showing up after they've allocated the funds. It's about demanding that the work that we said we were going to do gets done. And sometimes that means we are the ones who do the work. And I know all of you are in this room because that's what you do every day, but you have thousands upon thousands of people waiting in an army of willingness. They need to be called upon by you. That's one of the reasons fair fight is so important to me. Folks would say voting rights, it's not connected to health care, but it is essential for health care. When voter suppression happens, the very people who need access are the ones who are kept out of the ballot box. And therefore, people are elected who do not hold their best interest at heart. Now, the person who did win the governor's mansion in this past election has decided that, yes, he hears the 71% of Georgians who said Medicaid expansion is necessary in Georgia. Now, we were asking for $150 million a year to expand Medicaid for everyone. He's asked for $1 million to think about it again. So education worked. We got people to talk about it. advocacy worked. It got 1.9 million people to vote about it. But activation has to happen now because we need him to do something about it. And in the 14 states like Georgia that have refused to expand Medicaid, they should not be allowed to rest until they have heard from every one of us. That is our responsibility. And as Sister Simone said, I'm also launching an organization that's going to make certain there's a fair count in Georgia when it comes to the census. Because we know that when they don't see our communities, because our communities are undocumented immigrants who still deserve access to health care, when they don't see those young people whose parents can't get time off of work to take them to get that second round of immunizations, when that young woman doesn't want to ask anybody about the lump in her breast, and that older man doesn't want to tell anybody about the pain in his side, when a mammogram or dialysis could save a life, then we have to have a fair count. Because the reason there isn't a mammogram machine is that they didn't get the right allocation in that low-income community. And the reason he's afraid to talk about dialysis is that he's afraid that he can't afford it because his community clinic shut down last year. Our responsibility is to activate those whose lives are on the line, and they will stand up if we speak to them with authenticity and truth and compassion. It's one of the reasons I'm so excited to have had Sister Simone Campbell introduce me. It's as close as I'm ever going to get to being a Catholic. But there's a moment of grace when somebody tells you they see you. And that's the work that you do. The work that you do when you educate, when you advocate, and when you activate is that you spread grace. You give people a moment to know that they are not alone in their individual misery. And this means something to me. I have a younger brother named Walter. Walter is a brilliant young man. He went to Morehouse College. He's the fifth of the six of us. There's 6 kids in my family. But Walter didn't finish Morehouse College. I can talk about the litany of my siblings, one who's a college professor and the VP of diversity, another who's a federal judge, the first black woman to be a federal judge in the history of Georgia, another brother who's helping to run a homeless shelter for young people in the city of Atlanta. My little sister who works for the CDC, she does evolutionary biology and molecular systematics. I don't know quite what that is. But we can't list my brother Walter in the litany of achievement that my parents were able to create for us, because my brother is serving time in a Mississippi State prison again. My brother's not a bad person, but for more than 20 years, or about 25 years, we didn't realize he was bipolar. His bipolar disorder went undiagnosed because when he started getting in trouble as a teenager, my parents didn't have health insurance. And our school system was under-resourced, so they didn't have school counselors, and so he went undiagnosed for most of his life. And it wasn't until he was arrested for drug use and for committing crimes to support that drug use that we realized, because in prison they diagnosed him, that we found that my brother was bipolar. Because you see, as a free citizen, he was not entitled to health care, but as an inmate, he was. And as an inmate, they discovered that there was a direct connection between my brother's dependency on drugs and his self-medication for an undiagnosed mental disorder. Not one that diminished his humanity, his morality, or his intellect, but one that made his behavior harder to manage. And while he was in prison, the first time my brother got sober, he got stable, and he was a better person. But the minute he was released from prison in Mississippi, like across the states, he lost his health care. And in a state like Mississippi or a state like Georgia, he was not entitled to Medicaid expansion. And so he did what so many ex-offenders do. He relapsed, he reoffended, and he was reincarcerated. And whether the addiction is crack or cocaine or opioids, we know that we have prisons full of people who are simply trying to make it through a day. And when my brother relapsed and when he lost his way, it wasn't because we didn't try to help. We tried, but we couldn't afford his medication. And he couldn't get health insurance. And they said, well, just get a job. But you know you can't get a job when you're an ex-offender, and certainly when you're one with a drug dependency. And so we have this vicious cycle in our society that sent my brother back to prison. Now, I don't exonerate him from his behavior, but the accountability must be shared. And it's through acts of grace that we talk about my brother Walter, that we expand access to Medicaid, that we create opportunities for mental health care, that we stop filling our prisons with the sick. But that only happens when people of good conscience, people of good heart, and people of good action stand up and speak for them. So first I need you to do what? And then I need you to do what? And third, I need you to do what? And if you will educate, if you will advocate, if you will activate, we will victory claim for America. Thank you so much.
The government shutdown is now in its